Hey, what's going on, guys? And in this lecture, I'm going to be discussing some updated draft guidelines by the USPSTF. Now, what I mean by updated draft guidelines is that these guidelines and recommendations aren't final just as of yet. But essentially, what they're trying to figure out and what they want to address is the routine use of pelvic exams in the asymptomatic female. So as of right now, they have insufficient evidence to recommend routine pelvic exams, right? So here's the thing. You have a patient that comes in for their annual exam, their physical. Do you do a pelvic exam? And they're saying that there isn't enough evidence to say you should. Now, if you look at ACOG, they recommend universal screening with pelvic exam doing a bimanual in females over the age of 21, whether you're pregnant or not, right? But if you look at the American College of Physicians and if you look at the American Academy of the Family Practice Physicians, they recommend against universal screening. And personally, I don't do routine pelvic exams. The only time I do a pelvic exam is if the patient's due for a pap smear and or if they have signs of possibly having chlamydia or gonorrhea. And these are the indications that the USPSTF also recommends. So if you're screening for STDs like chlamydia and gonorrhea, or you're doing a pap smear, but remember, pap smears are once every 3 years, the USPSTF obviously says, yes, go ahead and do that. And in 2010, the USPSTF estimated that about 60 million pelvic exams were done, and they found 0 studies to date that actually demonstrated any type of benefit and or any decrease in morbidity and or mortality. So why are we doing pelvic exams? And this is what they're trying to answer. And then they go on to actually discuss the ovarian cancer. Well, maybe if we do pelvic exams routinely, we can detect ovarian cancer. So they looked into ovarian cancer and they actually found that by doing a pelvic exam, there was a false positive rate of 1 to 9% and a false negative rate of 0 to 100%. They also found that surgery due to an abnormal pelvic exam occurred about 5 to 36% of the time. So with these false positives and these false negatives, we are still doing surgery based on the abnormal pelvic exam. So you could see why there might be some controversy in doing routine pelvic exams. So this is what's going on with the USPSTF, but I don't think that they're going to change their mind. ACOG even announced that they will be looking at these draft guidelines, these revisions put out by the USPSTF to see if they need to revise their recommendation on doing universal pelvic exams in patients who are over the age of 21 who are non-pregnant. Now remember, this does not exclude STD screening. This does not exclude pap smear screening because we know pap smear to detect cervical cancer decreases mortality. So if you have any questions at all, I'd be more than happy to answer. Please send an email to tuitionassistantboards.com and I'll see you on the next video. Take care.